My final guest is Keysha Brooks-Coley, the Vice President for Federal Advocacy and Strategic Alliances at the American Cancer Society Cancer Action Network, also known as, if I'm getting this right, ACS-CAN. Keysha serves as head federal lobbyist for this advocacy arm, and we're excited to have her with us today. Keysha, thanks so much for joining us. I don't know if you heard the conversation I had with Congressman Davis, and he's been working on colorectal cancer, but on a variety of other things. And, I always lucky to meet fascinating individuals who are trying to make a difference in people's lives. But one of the things I wanted to do today was to sort of get an understanding of how the patient sees this environment he or she may be in. And so I'd love to hear from you as you're kind of looking at patient advocacy and what our audience needs to know about what's not there for them and what they really need as opposed to what's prescribed necessarily. What are some of those things?
Sure, and thanks, Steve. Appreciate your invitation to allow for our voice to be included in this conversation. And your question around the patient environment and what is important to the patient right now. What's important to the patient right now is access. And it's access to affordable and quality health insurance and access to making sure that they can be able to receive the treatments and innovative cures that are so important for cancer patients. And coming now through COVID, I think we all have seen our healthcare system in different ways. And from the patient perspective and from ACS-CAN's perspective as a patient advocacy organization, we are looking at it through that new lens as well. We're looking at it through the lens of making sure that people have access. We know that when your cancer is diagnosed, your treatment outcomes and your survivorship rates are based on your access to health insurance. We know how important that is. We also know that we need to be looking at a lot of the important healthcare issues that we're talking about currently through the health equity lens. Through COVID, we saw that health issues impact different populations differently, different individuals differently, and we have to look at how minorities are impacted by healthcare issues, especially through cancer, and that's something that ACS-CAN has done for many years, and we're looking at it even more closely because from the patient perspective, we know that it shouldn't matter where you live or what community you're in, what your zip code is, the type of healthcare that you receive should be the same. It should be affordable. It should be quality, no matter where you're sitting in this country.
Keysha, let me ask you a question, and I may mess this up, but I am just too aware that many people of color who go into the healthcare system are not treated equally and do not have the same experience. We've interviewed many of these people on this show, and we know that data don't lie, and the data show difference in life expectancy, difference in impact. We saw this with COVID. We've seen it in, maternal mortality, a lot of fronts. And so I guess my question is, what do we do about it what do you do about it with your patients when they're not getting that fair and equal experience that, others in American society are getting?
Really important question, Steve. And it's something that ACS-CAN has been looking at very closely over the past few months. As you said, we know we have evidence-based research that shows, even if you just look at the cancer side, that cancer patients, dependent on their race and ethnicity, oftentimes, as you noted already, don't have the same outcomes, even though they have sometimes even often have insurance, and when you take insurance into consideration, they don't have the same outcomes, and it's a question of why. What is leading to these disparities? And ACS-CAN, along with the National Comprehensive Cancer Network and the National Minority Quality Forum, actually engaged in a project a number of months ago to engage cancer patients and survivors and oncologists to look at these issues more closely. We did survey work that showed that minority patients feel that they don't receive the same type of care as their white counterparts. That's a question of why. How do we address that issue? And oncologists also stated that they felt like they had actually participated in issues around bias and interacting with patients differently disproportionately based on race, and that's an issue that has to be addressed. From the project that we're working on, we have a number of policy changes that we're looking at to make sure that the healthcare system is one that individuals from diverse backgrounds can have a better opportunity to be engaging with their healthcare system with better outcomes, looking at the issue of making sure that clinical trials are diverse, making sure that patients have access to patient navigation services so they can actually navigate the healthcare system, something that has shown that when minorities have access to those types of services, then their outcomes are better. And then also looking at screening and the need to make sure that everyone has access to screening and increasing more funding for programs such as the National Breast and Cervical Cancer Early Detection Program that provides life-saving screenings to women who don't have access to coverage. So we know what the problems are, and it's really actually it's a good time to actually be able to be in this climate where a lot of people are focused because of COVID on many of these issues, ones that are not new, ones that many of us in the advocacy space have been working on for many years, but it's definitely a moment in time.
Well, I really appreciate your candor on that. I know it's a tough issue, and I've talked to so many people, and I think COVID, when you look at the Native American community, look at Black and Brown communities, others, there have been efforts. We'll have to see whether they work, but at least it's been discussed a lot of, kind of took it. You wonder how not to lose the momentum of at least the perceived need to reach every community, but I remain skeptical, as you sound as well. Hopeful, but skeptical. But
absolutely hopeful. It's a moment in time, and definitely hope.
Yeah, hopeful. Let me ask you, if you were to advise the Biden administration on how to square some of these circles on costs and insurance and affordability and access, what would be some of the things you would like to see the Biden team take seriously?
Sure. So I think from our organization's perspective, it was great to see a number of provisions that were included in the Rescue Plan Act that passed a few months ago, addressing issues around cost and access, making sure that individuals at a lower FPL have access to subsidies to allow them to be able to purchase insurance, increasing the FMAP for Medicaid, to incentivize more states to move forward to expand Medicaid. We know that those are ways that we can actually make sure that more people have access to coverage. On the affordability side, cancer is expensive. We know that cancer patients actually paid over $5 billion in out-of-pocket costs in 2018, and which is the most recent data that we have. And that's an issue that has to be addressed. One of the things that ACS Can had longstanding policy on, for example, is having a cap on the Part D program and making sure that individuals who are in the Medicare program have a cap on their out-of-pocket expenses for their drug costs. And so those are a couple of things that we're looking forward to continuing to have conversations about and continuing to advocate for. The last thing I'd mention too, because I think it was clearly something that was extremely important that was included in that bill, was even just having the special enrollment period open, which yielded over 500,000 people across the country to be able to access insurance. That was something that we had advocated for a number of months last year, that has allowed for more people to have access, which is, from our perspective, life-saving access to care.
Keysha, is there anything else on the cancer front? Again, you're talking to Rod Davis, talking to many members of Congress on cancer. Cancer is so pervasive in many ways. There have been a lot of gains made in terms of extending life, cancer remission. Basically, we're living at the same time that we're living with all these incredible technological achievements in health. We're also kind of dealing with, incredible fragility in how it's deployed. But I'd just love to say, if there's anything else that you'd like to share with our, patients on, that cancer patient and helping him or her navigate it. I know you used to work in the Senate, and I always wonder, how do you make the link from the policy battles in the Senate to that individual who's got cancer? What should we hear? Sure,
Steve, and I think you make that connection with the the patient stories. We always lead with our patient stories, even as someone who is a professional lobbyist who's advocating on behalf of our volunteers. Our volunteers speak well for themselves as well, though, and tell the story of why the policy changes that we advocate for every day are so important. And I think one of the last things I would leave you with as an issue that is extremely important for us, that is very much top of mind and is encompassing our health equity and health disparities work too, is access to screening. Again, with COVID, we're looking at things in very different ways. We know that the screening rates have been declining. They're starting to inch back up, but we know that cancers have been diagnosed later or will be diagnosed later because of COVID. The American Cancer Society has a back to screening initiative to make sure that Americans know that they should be looking at how do they safely make sure that they're getting their cancer screenings. And that ties into our work that we'll be doing for advocating to increase funding for the National Breast and Cervical Cancer Early Detection Program that the CDC actually initiates across the country. And that issue is one that is just extremely important for us. It's all about prevention, as we know, but prevention is only as good as people who have access to those life-saving preventive screenings. So that's one issue. But again, the patient story is what we lead with, because we know that cancer touches almost everyone's lives and many, many people across this country.
Well, Keysha Brooks-Coley, Vice President of Federal Advocacy and Strategic Alliances at the American Cancer Society Cancer Action Network, ACS-CAN. Thank you so much for joining us today and sharing your thoughts.
Thank you so much, Steve. Appreciate the opportunity. Take care.
Take care. That brings us to the end of our program today. A big thank you to Pharma for its support and all of you attendees for joining us for this discussion. For those of you who missed any of the conversations, we're going to have this video up from the event on our website shortly. You can watch it all there again or share with your friends. I'm Steve Clemons. Be well.